If your NHS hip replacement surgery is being delayed, or you've been told there's a waiting list of many months or years, this video is for you. I'm Mr. Kumar, consultant orthopaedic hip and knee surgeon. I work both in the NHS and private sector, and I'm here to help you with your hip pain. So the reality is the health system is under immense pressure and patients are suffering as a result of it. In fact, you don't need to wait. Private surgery may be more accessible than you think. You can take control of your health needs by considering self-pay package options for your hip or knee replacement surgery. Patients often think they can wait 1 or 2 years to have their joint replacement surgery, but these are things they may not consider. Here's why waiting is not always the best thing for you. One of the consequences of osteoarthritis in your hip or your knee can be muscle wasting. If you get muscle wasting, you'll get poor joint function. Therefore, your ability to do daily activities such as walking, cycling, or running will be significantly impaired. Secondly, this can lead to joint stiffness. It's going to be a lot more stiff in the morning and will take time to loosen up during the day. And that's when patients start to get more pain in the evening as they rest. So joint stiffness ultimately will affect your ability to walk, cycling, running, or participate in other activities. But it isn't just the physical aspect. What about the mental health? This is often overlooked. We take for granted walking and doing our daily function, but when that's impaired due to arthritis and needing a joint replacement, we start to worry about how that's going to affect our mental health and well-being. Joint replacement surgery can significantly help that. One of the most common things patients ask is how much is it going to cost? I believe healthcare shouldn't have any hidden fees, and that's why I'm going to be completely transparent with you. A joint replacement tends to cost around £15,000. Now hold on, don't click off the video just yet. Let me talk you through it. You may think £15,000 is a lot, and it is, but here's what it covers. So a large portion of that is the hospital fee. There's also a surgical fee, which I get, and a fee which goes to the anaesthetist for your surgery. Let me break down the hospital fee. This includes the operating costs. The operating costs overall includes the cost of your medical grade implants. This is designed to last for 15 to 20 years. So it is costly to produce and maintain those implants. Additional costs include the surgical equipment that we use, for example, the sutures, the dressings, any blood that you may need, fees for the staff to assist during the surgery, but also maintain your nursing care during the operation. It also includes any medications you may require, such as pain relief and anesthesia. And frequently, we use robotic surgery. So this includes a cost of robotic surgery. So this proportions the operational costs, but also there's the admission and overnight stay. So this includes the fees for your room for 1 or 2 nights during your joint replacement surgery. It also includes your meals, your nursing care, and your observations during your stay. Importantly, it also includes your physiotherapy during your surgery, whilst you're in hospital, and also when you're discharged during your recovery period. In your total package cost, this also includes your follow-up appointments with myself and the physiotherapist. The reason for me breaking this down is so you're fully informed of the costs and the background charges that are involved. This will help you make an informed decision about your hip replacement or knee replacement. What this fee doesn't show is the benefits patients get for private care. 2 of the biggest benefits of this are speed and continuity of care. With speed comes flexibility. What I mean by this is that when you decide to have your operation, you can choose a date that suits you, that fits in with your lifestyle and your other commitments. Continuity of care. This is the biggest thing my patients thank me for. You get to see me where I will look after you personally during your whole pathway for your surgery and aftercare. Compared to the NHS, and don't get me wrong, it's a great system, but you aren't guaranteed to see the same doctor who did your surgery during your follow-up. This isn't necessarily a bad thing, but often patients find comfort in seeing the same consultant before, during, and after their surgery. This is exactly what you get with me. I will see you during your initial consultation, during your surgery, and in the follow-up recovery period. I know this is a significant financial decision, so it's not something to take lightly. To help spread the costs, we offer flexible 0% finance options. Your health is an investment, so you should have all the necessary information for you to make an informed decision. Don't let joint pain dictate your life. Click on the link below or visit mrkumar.co.uk to book a consultation. Let's get you moving again.